Well, Cheryl asked me to talk tonight on addiction and food, and addiction to not just food, but other things as well. And so that's the topic for tonight. And does diet play a role in addiction? Is there a connection there? Can you get addicted to food? Yeah, it looks like it. And does food addiction play into other addictions? So we'll talk about that. First of all, what happens to the brain in response to repeated exposure to addictive substances? So we'll look at it broadly first. And can you name something that's addictive? A substance? Okay, well, you're starting off with sugar, and you'll find, yes, you're right. Come on, go for something easy.
Cocaine.
Cocaine, there you go. Yeah, it's addictive. Cocaine and heroin and all that. Well, what happens to the brain when you get that stuff? Well, here's what happens. There are three areas in the brain that are affected. The first one is the basal ganglia. There are some other names for this as well, but it's basically where the reward circuitry is in the brain. And when this area is exposed to intense pleasure, like with cocaine, on a repeated basis, what happens? The body turns down the gain, if you will, or it actually starts down-regulating the number of receptors for dopamine. There are two different receptors, as you'd guess, D1 and D2. Both of them are reduced in the reward circuitry when your brain or when your body is exposed to repeated doses or repeated exposures to addictive substances. It's sort of like you walk into the house and the radio's too loud. What do? You turn it down. And the brain is similar. If you have repeated intense pleasure, the brain turns down the gain. And you think, well, what's the result of that? Well, the result of that is you need more, right, to get the same amount of pleasure. And so you start off, let's say you're a heroin addict, and you start off with a low dose, and that feels really good. I remember when I was in residency, I worked in county hospital, Riverside County Hospital, and we routinely would have heroin addicts come into the hospital for detox. And, I thought, well, this is really good. We're getting them off of heroin. And then I started talking to them, and they said, no, I don't want to stop heroin. It's just I can't afford my habit, and I want to be on 1 bag a day instead of the 5 bags a day that I'm doing. He said, there's nothing like it. I just really love the feeling. It just makes, when I do my shoot up, I feel like I'm the king of the world and nothing matters. And a very pleasurable, but what he was finding is the more he does it, the less effective it is, and so he'd come in for detox. Well, that's interesting. So if you get into addictive substances, they're less and less pleasurable. Yeah, that's what happens. And that's true with all addictions. Over time, they're less and less pleasurable, and we get more and more problems, as we'll see. The second area that's involved when you're exposed to addictive substances is the amygdala, the extended amygdala. That is, it's more than just the amygdala itself, it's the tissue around it. And normally the amygdala fires when you're frightened. And when it really gets ramped up, you get anxiety and irritability and unease. It's like, have you ever, wondered, what's going on? Am I safe here? That's your amygdala firing. And the amygdala, with repeated exposure to addictive substances, its activity is increased. And that's particularly true when you're withdrawing from these addictive substances. So you have you shoot up with heroin, And then what happens when they're withdrawing from it? They get anxious and nervous and irritable, and so they have to have another fix. But their another fix has to be more if they've had it several times in a row, because their brain has downregulated the receptors. So you get two problems there. And then the third area of the brain that's involved is the prefrontal cortex. Now, most of you probably know that the prefrontal cortex is what powers the ability to think and to plan and to solve problems and to make decisions. And particularly, it helps you to maintain self-control over your impulses and over compulsions. So as the prefrontal cortex is downregulated, you're more compulsive and more impulsive and less reasonable, if you will. I got to get my drug. Well, it's not safe for you to go out. I got to get it anyway. Well, I don't have enough money. Well, I'll rob a house. You know, and that's all from measurable changes. We can see these changes on brain scans that occur with repeated exposure to addictive substances. Fascinating that changes actually happen there. Well, the question, of course, is there anything that predisposes a person to the risk of addiction? How is it that some people get addicted and others don't? I've had patients that, you know, they took a puff on a cigarette and they said, boy, that's nasty, and never had another one. I have other patients, I saw one today, who started smoking when she was 16, and she's almost 60 now, and she smoked on average a pack or more a day. Why? She's addicted. Well, why does one person say, it's nasty, I'm not going to do it, and another person say, I can't put this down? And there are other addictions besides tobacco. I mean, tobacco's a tough one. It's as hard to give up as heroin, believe it or not. It's a really tough addiction to break. I was talking to this gentleman in the front row. He said he, a month ago, gave up caffeine. Caffeine's addictive. He's, you know, it wasn't easy to give up that coffee, was it? No, he had to go through some withdrawal. His body wanted that stuff. So there are various addictions, but they all work in the same general way. And the question is, why are some people at higher risk for addictive substances and addictive behaviors, if you will, than others? And you can read multiple papers online about this, as I did, and they're a list of, 6 to 10, depending on what you read. But everyone agrees that early childhood trauma or abuse increases a person's risk for addictive behavior. So as you think back, if you find yourself addicted, I guess you can blame your parents, right? Well, we'd like to. Another thing that increases your risk is post-traumatic stress disorder. You've had a really bad, stressful happening that's shattered your life. Some of you probably know Vietnam veterans that it was really traumatic for them to go through what they went through. And I had one patient, he's deceased now, but whenever he'd hear loud noises, he'd had flashbacks and just, lose it, because he'd go right back to when he was in Vietnam. There are other things, even early childhood trauma can give you post-traumatic stress disorder. And then if you have a dysfunctional family, you're much more susceptible to addictive behavior. Mom and dad didn't get along and they yelled at each other, and, on and on it goes. And when they come out into public, everything's just nice and fine, and then when they go home, everybody yells and someone knocks on the door, and then everything's fine. Yeah, no one here has experienced that, but maybe you've heard of someone. If you have parents or grandparents who have had addiction, Addiction ran in my family. I had an uncle who was an alcoholic. And that places you, if you have addiction in your family, it places you at a higher risk for addiction. There's a genetic component to this as well. Another thing is significant peer pressure with lack of effective parental guidance. And there's two things going on there. One, your parents need to give you better guidance, but the second thing is, if you still have parents giving you guidance, you're probably young. And in fact, peer pressure in teenagers and younger is particularly damaging because the prefrontal cortex isn't well developed until you're in your 20s. And so peer pressure is much more formative on a kid than it is on someone in their mid-20s, because you can reason better, although if we had some teenagers here today, they'd probably disagree with me. I certainly would have when I was a teenager. No, Dad, I can outsmart you. You know, Mark Twain said it was amazing how much his father had learned between when he was 16 and when he was 20. And yeah, that sort of happens. But if you're exposed to peer pressure to take addictive substances before you reach your 20s, you're much more likely to delve into that. And along with that, number 6 there, early exposure to addictive substances. If your parents smoke and they say, try one, yeah. If you're in your, this lady was about 10 when her father said, hey, want a cigarette? She tried it and she was hooked solid by the time she was 16. Well, that's tough. So the question is why? Why does that happen to people who experience childhood trauma or abuse or dysfunctional families or parents or grandparents or others who are addicted? Why is that? Well, all of us like pleasure, right? How many of you don't like pleasure? Anybody here? Generally speaking, people that struggle with obesity don't experience as much pleasure from their food as people who don't struggle with their weight. And you'd think it'd be just the opposite, right? You'd think, well, if they're eating more, they're really enjoying it more. No, and that's true with drug addiction too, right? The first time he used it, man, that was amazing. But after he'd been on it for a year or two, I got to get another fix. I'm just not feeling good. Wait, he's not feeling amazing. He's just not feeling good. He's not getting the same pleasure from the substance. And so if you really want to heighten your pleasure, maybe you don't do things repetitively and down-regulate your brain. So think about that. But there's something else too. And this brings up the next thing. What's the difference between joy and pleasure? Is joy just a lot of pleasure? I mean, they're different words, right? They're related. So tell me, what's the difference between joy and pleasure? Or someone want to define joy for me? What's joy? I'm not talking about a lady named Joy, but she might be nice too. But what's joy?
I think of it as happiness.
Happiness, okay. Someone want to refine it a little more? I mean,
no matter what your situation is, you have joy.
Okay, so joy is something you can have apart from circumstances. All right. What would it?
Happiness.
It's what?
And apart from happiness.
So it's sort of like happiness. It's related to happiness, but there may be more to it. So I remember when my wife gave birth, And that was painful for her. And it was kind of painful for me. It was painful to watch, but I wasn't in pain. But you know, all that pain was gone when she had the baby in her eyes, and there was real joy. She wanted that baby. Not everyone that has one wants it, but if you want a baby and the baby comes and the baby's healthy, there is joy, right? Even though, so wait a minute, joy can kind of commingle with pain, right? It isn't heightened by pain, but she was willing to go through that process 3 times. She knew the pain was going to come the second and third time, but she still wanted that joy, okay? I remember getting married, and there was some joy in that, but I have even more now after 44 years. Can you imagine that? I mean, now what does that tell you? I had a lot of hormones when I first got married, still have some, but I've got more joy now. Why? More intrinsic? It's more dependable, this thing called love now. Yeah, and it's more relational. And joy is relational, isn't it? I mean, I remember another really time of intense joy, and that's when our boys got married to really nice ladies. And there was some joy there. I remember when our third boy got married, I said to Lynn, "Isn't this good? I'm finally done." Little did I realize that that wasn't the case. Now we've got grandchildren and I'm nowhere near done, but there's joy there too, right? So joy is really interesting. It's derived from a deep sense of meaning and purpose, which is most often relational, right? Okay, and some people, because they've been damaged by someone's taken the joy, they're dysfunctional families, they've been, I was talking to a lady recently, and she said when she was little, her father, when they'd go swimming, just would take her head and push her under and hold her under until thought she was going to die. And then she'd come up gasping and he'd say, "And so don't trust anybody." Can you imagine that? Do you think she might be having problems experiencing joy? And if a person's like that, then they're going to seek for pleasure, not joy. And so you're more susceptible. I've had patients who were alcoholics. And you know, you think, well, alcoholic. No, they had so much pain in their life that the only way they could exist was to drink to numb the pain. And they'd get some pleasure from the alcohol because there was so little joy in their life. And so if you think of pleasure and addiction and pleasure and joy, addiction comes when all you've got is pleasure to seek and you don't have a lot of joy, right? And so the problem is when you're seeking for pleasure and you go for more and more, you get less and less. And so there's addiction. And that can happen, we know, with alcohol and with heroin and with cocaine and with benzodiazepines and a whole lot of things when we're seeking for pleasure or release from discomfort, when really what we need is that deep joy that comes from a sense of meaning and relational kinds of things. Okay? You with me so far? I was talking to a lady at work today, and she said, "So what are you going to lecture on tonight?" And I described it, and she said, "You just described my life." She said, "That really helps me understand why I have struggled with addiction all my life. Because I grew up in a dysfunctional family and I had a lot of childhood trauma and abuse, and there wasn't joy growing up. And it was everything's fine on the outside, but on the inside it was trouble. And she said, I have always been seeking for pleasure because I had no joy. Fascinating, isn't it? How that works. So keep that in mind. Those who experience deep joy in their life are less likely to crave and experience pleasure to the point of self-harm. Okay? We're all made for pleasure. I love good soup. Was that pleasure? I mean, not for Bill, but was that pleasure? Did you enjoy it? Yeah, I mean, it was good. It wasn't intense pleasure, but it was a satisfying feeling. You had the pleasure of knowing it was good for you at least, right? But I don't think you're going to come up here and eat this until you harm yourself. No. A bowl or two, some came back for seconds. I didn't see anyone come for thirds, but if you did, it's still not going to harm you, right? And good food, you eat and you're satisfied, but you're not tempted to eat to the point of harm, right? So keep that in mind. Let's talk about food addiction, okay? We talked sort of about addiction generally. Now let's talk about food addiction. And there are a couple references here. I didn't put many down. I went through lots of articles, but here's some ones you can look up if you want. Drugs and high-fat, high-sugar foods both activate the same circuit of reward and pleasure in the brain with repeated exposure to either. And it's characterized, as I mentioned, if you have a repeated exposure to either high-fat, high-sugar or drugs, you'll have a downregulation of dopamine receptors. That's interesting. Now, I didn't say high-fat foods. I said high-sugar, high-fat. High-fat foods don't seem to do it. You got to have the sugar and the fat, or you can get it with just sugar alone. Now, if we had had a really good apple pie with good ice cream up here, and no one was watching how much you took, would it have been a little easier to eat more than you should? Yeah, it would. Now, if you did that every night for a couple months, do you think you might need a bigger portion? You would, to get the same pleasure, because you would have downregulated the pleasure centers in your brain, the dopamine receptors. That's not to say you shouldn't have apple pie and ice cream occasionally, because if you have it occasionally, you're going to get a lot of pleasure from that. Okay, especially if it's the apple pie that I recommend with our ice cream, which is really healthy for you, but it still tastes good. But, you know, you have to be careful with some things, don't you? We know that if you have a high sugar, high fat food, it will downregulate the same brain pathways that are downregulated by cocaine. Interesting, isn't it? Okay. So here's the next one. Long-term high-sugar diet produces cocaine-like effects on dopamine receptors. Same thing. So high-sugar diet, cocaine-like receptor, and cocaine, it reduces the dopamine receptors and increases anxiety and depression and increases compulsivity and impulsivity. That's something. A high sugar diet will make you more compulsive and more impulsive. You want your kids that way? It's easy to get them that way. Just feed them a high sugar diet. You can do that with cocaine or with sugar. It's the other white substance. Yeah, okay? That's a really interesting article in Nutrients. Now here's another one. Prenatal and early childhood high sugar, high fat diets increase the risk for obesity, you'd expect that, and for substance use disorder. Ooh, that's tough. You want to keep your kids or your grandkids from being susceptible to taking drugs? Well, then be careful what you feed them. Soda really does this. There were several studies I reviewed where all they did was they took soda out of the kids' diets and their risk went down and their brains cleaned up, because soda is engineered to push your sugar button as hard as anything. It is addictive when you get it often enough. Here's another one that I found really interesting. Oh, I should say prenatal, they did some studies on women. Women who had a high sugar diet during pregnancy, their offspring were more susceptible to substance use disorders. Ladies, be careful what you eat. You don't want to program your children for trouble. Here's another interesting one. Bariatric surgery patients with high sugar diet addiction preoperatively had higher rates postoperatively for new onset substance use disorder. Isn't that interesting? So if you take someone who has a high sugar diet, that is, they're addicted to the sugar, they have addictive behavior, you do bariatric surgery, they lose a bunch of weight, change their diet, but their brain's the same, they're at higher risk for substance use disorder. That is, they're looking for drugs. Because why? Because they haven't addressed the underlying problem. Where's the joy? And what they're doing is they're seeking for pleasure because they don't have joy in their life. And if we really want to address this, we have to address relational issues and meaning and purpose in our lives. Now, one of the most successful programs for dealing with addiction is Alcoholics Anonymous. You're aware of that, right? Why does it work? Why does AA work?
Well, you talked about being relational, so you're seeing
It's deeply relational, isn't it?
people, and then also looking at the purpose and meaning. There's a higher power
Yes.
as well.
Yeah, it is definitely relational. I mean, I've been to AA meetings. Lynn, my wife, Lynn has been to them as well. She worked a lot with alcoholics. And, you know, you say, the first thing you do is you say, "Hi, I'm Dick, I'm an alcoholic." And they say, "Hi, I'm Joe, I'm an alcoholic." And you go around and you have a sense of belonging. We're in this together. And then there's the steps you go through. And one of the things you do is try to help other people and get them to come. And suddenly life takes on a whole new meaning. And it's a very spiritual experience. And so they're dealing with this issue of no joy, right? And reconnecting. So I think when we're dealing with problems ourselves, and there are addictions, others. I mean, there's gambling addiction. Why do people do that? Well, we know now. I mean, they're at higher risk for these things because they've had the joy taken out of their life, and then they get into that. Or pornography. You know, a person can have a lot of pleasure with an illicit relationship, but they're not going to have a lot of joy, right? That takes, you know, like about 44 years. And knowing that that's going to keep going, and faithfulness and commitment, and, you know, then the joy starts building, right? And then there's place for real pleasure without pleasure driving the situation. You don't want pleasure to be in the driver's seat. You want joy to be there, and then the pleasure rides along. Is the ideal thing. So here's some recommendations in sort of summing it up. Number one, and I've said this many times, choose your parents wisely. Genetics plays a big role in this, and if your parents are dysfunctional, you're going to have more problems. Does that mean you can't overcome this? No, you can. But be aware of it. If your parents had problems, if you had problems, think about your kids and how to help them as well. So choose your parents wisely. Number two, seek joy through meaningful, purposeful living. Pleasure is best sought and experienced in the setting of meaningful, purposeful relationships. My wife has a book, I forget the name of it. Remember the drug addict that got a cat and it transformed his life? It's quite a, what was the name? Bob. The cat's name was Bob, and this guy was on the streets of London, and he made his living busking. And the only reason he did it was to get his next hit of heroin. And then he got a cat named Bob. And it transformed his life. It gave him some purpose. And that brings me to number three. Seek meaningful human friendship and association, but if that isn't possible, at least get a pet. And that can make a big difference for you. You know, people with pets have less dementia. Yeah, if it runs in your family, quick, get a pet. People that have a good marriage, much lower risk of dementia. Again, meaningful, purposeful. Here's another one. People that have dogs live longer than people that don't. But if you have a dog and walk the dog, you'll live 7 years longer than if you have a dog and don't walk it. So walk your dog, or at least get a leash. You can walk the leash. So if you don't get a pet, they're wonderful. A Cat Named Bob, was that the name of the book? It's a great book, and it's all about addiction and how that cat transformed this guy's life, and he was able to get off drugs and get his life together. And he wrote this book that was a bestseller. He probably is a millionaire now. I don't know, all because of a cat. Number four, remember you can rewire your brain. I have a patient who's been my patient for nearly 30 years now. I met him in the intensive care unit right here at Parkview. I admitted him to the hospital. He was drunk as a skunk, and he went into liver failure while we were trying to dry him out. And his liver advanced cirrhosis, and I told him, I said, if you don't stop drinking, you're not going to live. You know what? He hasn't had a drink since. And his liver is lousy, but it's worked. And it's gotten him through, and he's still doing amazingly good. He has rewired his brain and has not had a drink. And guess what? He found a good woman and got married, and he's got a great marriage. And I love the guy. He's just a treasure. And he's rewired his brain. I said, would you ever go back to alcohol? He said, not ever. He said, I have no desire whatsoever because I've got pleasure that alcohol never gave me, and I've got joy now too. So it makes a difference. You can rewire your brain. Number five, avoid high sugar, high fat diets and addictive drugs. They all act the same way. Now, does that mean you can never have a dessert? No. Just don't have one every meal, and don't binge on them. I'm not going to say you should never have, that you can have a drug once in a while, because that's not good. Although if you had it once, it probably wouldn't hurt you too much. I wouldn't do it. But with sugar, I'll say, if it's somebody's birthday, so long as you don't have 365 grandchildren and have a birthday party every day, enjoy it. And really enjoy the pleasure of the sugar and the relationship. If you're going to eat a dessert, never eat it alone. At least eat it with your cat, right? Yeah. But you want those special occasions to be relational, like a birthday party or Christmas. But don't have a holiday every day. And remember, repeated exposure to high sugar diets will downregulate your ability to enjoy the sugar. And you don't want to do that. If you're going to have something that isn't the best, well, at least you ought to enjoy it, right? Yeah. Okay. And number 6, I've already covered this. Remember, repetitive exposure to high sugar, high fat diets, drugs, or any other addiction reduces your ability to experience pleasure. You know, I want my life full of pleasure, don't you? I really, really do. And so think about that and avoid those repetitive exposures to things that aren't good for you in the first place. And I submit to you that the highest pleasure you will have is from a joyful relationship with a person, and if that doesn't work, a pet. And that really does help protect you from addiction. It really does. Just like it did for the guy that had Bob the cat. But that deep, meaningful, purposeful life is really important to think about, particularly as we're growing older. I had a patient in my office today, and her husband died 2 years ago. And I said to her, thinking about my lecture tonight, so what are you going to do this year for joy? She said, well, joy's been gone for me for the last 2 years. My husband died 2 years ago on New Year's Eve. No, on New Year's Day, which was our anniversary. And I said to her, well, that joy's gone, but if you had a new purpose in life, if you thought, how can I make the lives of other people around me where I live better? Could you find joy again? She said, you know, I think I could. Regardless of our age, young or old, we need to think about, how can I make the world a better place for my having been here? What can I do to make it better for others? And that's what gives us true joy, isn't it? Helping other people. Any questions?
You know, it may be too early for complete studies, but in terms of the addictions to social media, people being on their phones, I understand that that also triggers the dopamine.
Oh yeah, you know, my wife will tell you that I struggle with that, and I'm working with it because, and you've seen kids, they'll sit in the same room and they won't talk to each other, they'll text each other. Or I'll be sitting there with my wife and I'll be texting somebody instead of talking to my darling wife, you know. Well, that's addiction. Because it's, and you know, these devices, how many of you don't have a cell phone? Aha. How long ago was it that no one had a cell phone? 20 years? About 24. I mean, around 2000. Do you remember the first cell phones? You had to carry them in a satchel, put it in a backpack just about. And then I remember but now you can't get by. I asked my wife, why didn't you take your cell phone so I could call you? When she forgets it all the time, you know, because she's relational and she wants to be present with the person that she's with. And we need to be aware of that. I'm one of them. I need to be aware of that. I'd say to Lynn, well, I'm on call, which I am most of the time. I'm surprised. Well, I have my cell phone turned off, so they can't get me while I'm lecturing. But, it goes off in the morning, noon, and night. And then you feel like, well, I'm important. I got to answer this thing. Well, maybe you're not so important. You need to be important to the people you're with. And so you can have joy again instead of just... I'm looking forward to the day when everyone has arthritis in their thumbs. It's going to happen.
I was just going to make a comment too about addiction. And one of the other programs that I had taken here, we learned about the food industry itself, and especially the food products that have lots and lots of additives that we have no idea what's in them. But we learned that a lot of these food companies have what they call cravability engineers.
Yes.
Their sole purpose is to try to put things in food to get us to keep buying the food or essentially become addicted.
You are exactly right. And the best way to avoid that addiction is to make your own food. If it comes in a crinkly bag or a fast food restaurant, it probably has been engineered for cravability, for pleasure, for addiction. Because what do they want to do? They want to sell to you more and more. And if it tastes like this, you're not going to go across town for it. You might come to my house for relational stuff. It's really good for you. I love it. I want to have some tomorrow, but it isn't addictive, right? That's why I wanted to have this kind of soup tonight. So, it tasted good, but you're not going to come up and when my back is turned, take a bowl. Right? Yeah. If it was a really good sweet, you might try to sneak one out on me, but not this. And that's why we cook this tonight, really. Yes, it's good for your immune system. It's a really healthy food, and it tastes good. And you will not get addicted to that soup, guaranteed. Yeah. I appreciate that. Food addiction is real, and it's more of a problem today than it's ever been because of that very problem. Yeah. Well, thank you all for coming. And I believe next time it's hypertension and kidney disease, right? Oh, that's a lot easier for me. I deal with that every day. What's that?
What's the date on that?
It's the second Tuesday of March. Yeah. So, thank you all for coming.